Hello, I'm Dr. Sethuraman from India, currently in US, and I'm very thankful to Dr. Sundar of India and Dr. Tuchek in Austria for this honor. And I'm glad to speak on the topic that has been allotted to me as a keynote opening address. So I will now move on to the PowerPoint and switch off the video. Let me share the screen. I hope you can see the screen now. Yes. The topic is combining evidence-based practice with patient-centered approach for holistic healing. There is a disclaimer here. I'm not a music therapist. I'm a physician for the past 52 years and was a professor in India and in Malaysia for several years. Currently retired and staying in various places. I dedicate this talk to two holistic role model physicians, Charaka of ancient India, 4th century before Christ, and the 20th century famous physician, Dr. William Osler. They both highlighted, as the quote says, the importance of holistic approach to patient care. Now, the concepts that will be discussed in my brief keynote talk is curing versus healing, how piecemeal healthcare could create cure without healing, and 4 factors of healing. Based on Wickenburg 1988 consensus report, and how music therapy could incorporate these healing factors in its practice. Then a word on optimal healing environment and how music therapy could adopt the OHG concepts in practice. And sense of coherence approach to personal wellness. And lastly, the evidence-based music therapy practice. Then as an ending remark, let us consider how music therapists could combine personal wellness approach with evidence-based music therapy practice to practice evidence-based, person-centered holistic care. I'll share 3 eureka moments or moments of epiphany that I had in 80s and early 90s. The first one was when I had treated a guru, a yoga practitioner in 1985. He asked me, "Do you know the difference between healing and cure, doctor?" Then I was not very clear, so he explained, "Let us say, as we are chatting, your car is stolen. You find it out during lunch hour and report it to police. They locate it and get it back in a day or 2. The police will close the case as they have solved or cured your problem. But are you back to normal self after that? For example, tomorrow while you are at work here, will you be preoccupied with concern about the car getting stolen again? Or will you be a physician that you were before the stealing took place? So your problem is cured, but you are not healed until you manage to regain your initial earlier poise." So thus spoke the wise old guru, and that opened my eyes. And I started on my long path on turning myself from a evidence-based treating physician to a holistic, person-centered healer. And the eureka moment happened next in 1990 during the WHO workshop in Medicine and Society, when I heard the very enlightening talk by Elizabeth Sachs, a medical anthropologist, and Dr. Joran Thompson of Karolinska Institute, who was a pediatrician. And they convinced us that any therapy, regardless of whatever mode, traditional, mainstream, or complementary alternate therapy. It can be simply stated as an intervention that is done to the patient and information that is shared with them and the faith the person has in whatever we do to them. So this is what they convinced us with several examples. And they also highlighted this Wickenburg consensus of 1988, which was very new in 1990 workshop, saying that spiritual factor, Hawthorne effect, placebo effect was as important or even more important than rational scientific evidence-based treatment. In fact, they roughly gave a figure of 20% for rational therapy, 35% for placebo effect, 30% for faith in the system or Hawthorne effect, and faith in self or supernatural as spiritual factor was 15%, adding to the four components of healing. This is not the treatment, this is the healing part that occurs within an individual patient. So let us consider a little bit on these factors. The first one is placebo and nocebo effect. Placebo is I shall please, and the opposite nocebo is I shall harm. And any effect, positive or negative, attributable to a medication or procedure, not based on its scientific pharmacological properties. So Kapchuk is a director of placebo studies in Harvard University. He has said, it is time that powerful placebo be examined in all its facets so that we can all become better healers in our practice. It is not imaginary, and there are a lot of scientific studies showing scientific proof of placebo effect. This is the most telling example in 2001 published in Science, that normal PET scan of basal ganglia in a case in a normal brain, it shows the red spots, and pre and post, before and after administering a placebo, this is before administering. You can see the red dots are very minimal, and it enlarges almost to the normal levels after administration of placebo. So several such studies have been published showing the reality of this placebo response. And therefore, it is not an unnecessary or evil thing in clinical practice. It's a very desirable effect. The second one is caring as a beneficial force. That is very close to the original Hawthorne effect described in a classic Harvard study in Western Electric Company's Hawthorne plant in 1927. It's a 10-year study which showed that when employees perceived that employer cared, the productivity improved. Similar thing is seen in healthcare, where caring enterprises like healthcare, the client feels that he is cared for, he or she is cared for, he or she improves much better and feel much better. So there are evidence to show that more supportive the administrative faculty of healthcare, the shorter the hospital stay of the patients. So unfortunately, these healthcare providers and healthcare administrators have until recently ignored these seminal ideas, says Dr. Kerr White in 1996 in a seminal paper. The third factor is spiritual factor in health, which was very controversial for a long time, but no longer, as WHO partially revised its definition in 1984 in Southeast Asian, in Asian region, saying that health is a dynamic study of complete physical, mental, spiritual, and social well-being. And later, it was adopted in Geneva meeting by the WHO, and they even released a field test instrument to look at spirituality, religious factors, and personal beliefs, SRPB for short. And they even did a landmark study in 18 countries with more than 5,000 participants. And they found that SRPB factors, that is spirituality, religiosity, and personal belief correlated with quality of life domains. And therefore, it concluded and recommended that all the therapists need to assess our patients' spirituality, religion, and personal beliefs because they affect the perceived quality of life. Spiritual influences of it so powerful, it even decides the time of death. There is a Sumati Sundar reminded me, sir, please remind them of Bhishma. So the Bhishma is a king. On the right side is shown lying on a bed of arrows. So in a Mahabharata, the Hindu mythological epic, Bhishma has a power to choose the time of his death. So in spite of getting hundreds of arrows on his body, he decides to wait until an auspicious time of the year when he can leave the earth and leave his life. So that was a mythology. However, recently D.P. Phillips et al. Have published several studies. I have quoted 3 of them. And to say that the time of death is influenced by beliefs, especially astrological belief among traditional Chinese believers. Those studies are published in a prestigious journal, Lancet and American Medical Association journal. However, in spite of all these revelations over the past few decades, piecemeal specialty is the order of the day, especially in the mainstream medicine of specialization and subspecialization and super specialization. So that the 5 main pillars of holistic health are disregarded in the mainstream: the physical health, mental, emotional health, social health, environmental health, and spiritual health. These 5 pillars are equally important in a holistic healing of an individual case. So disciplines like medical sociology, medical anthropology, complementary and alternate medical therapies like music therapy, yoga therapy, they all have adopted this. And that is a lament of Charles Odegaard in the book Dear Doctor, a personal letter to physician. Now, how to ethically promote innate healing response without feeling that you are a charlatan or a quack? So it can be done even in evidence-based practice by speaking positively about treatment to promote the placebo response and Hawthorne effect, provide encouragement, develop trust, especially to promote Hawthorne effect, provide reassurance, support relationships, respect individuality and uniqueness of each case, and explore values together, and create ceremony, especially when milestones of healing take place. Ceremonious celebrations do make a difference in the outcomes. However, it has to be ethically balanced, and one must be beware of false claims. And evidence-based approach is the brake that helps to avoid unopposed going into this area of faith-based cures and forgetting evidence-based scientific approach. So now that finishes my first part, and let us move to the second part on music therapy and optimal healing environment. Healing and cure are complementary, both are essential. Healing processes could be preventive, could be restorative, could be palliative, so that one can heal even when recovery and cure are not possible, like a terminal cancer. Postmodern trend, therefore, is to create patient-centered optimal healing environment. So let us see how that is done and how music therapy can adopt these principles. There are 4 domains of OHE, or optimal healing environment: internal domain, interpersonal domain, behavioral domain, and external domain. And together they make healing as important as curing. So internal domain depends on the patient. The patient must first of all want to heal, wanting to heal, wanting to get better. And that depends on their expectation, their hope, their understanding, and their belief systems. And they should experience personal wholeness in mind, body, spirit, and energy levels. And music therapist attends to the client's internal factors by mindfulness and focus and sense of coherence approach, which I'll explain a little later, which basically looks at the comprehension of the client and giving them manageable options that seem meaningful to them to adopt in a holistic approach. I'll explain it again later. The second one is interpersonal factors. So the relationship between the music therapist and the client makes a big difference in this therapeutic relationship to promote wellness. Again, sense of coherence approach is important, and we can promote holistic healing by accepting the need for healing, set realistic goals in an interpersonal, mutually consulting manner, and engage in evidence-based music therapy practice, nourish the mind and body with music, and embrace lifelong wellness. So cultivating healing relationship and creating healing organization is the basis of interpersonal domain. The third one is behavioral domain, which refers to the client's behavior towards cure and healing. So practicing healthy lifestyles and applying collaborative medicine. So these are important, and music therapy can attend to behavioral factor by promoting healthy lifestyle and also integrate and align with mainstream medicine in a collaborative way. Now, a little 5 minutes on sense of coherence approach. Basically, as a mathematical formula, we can say sense of coherence, or SOC, is equal to understand plus manage plus find meaning. That means sense of coherence in our client is based on three things. First of all, the cognition. My world is understandable. The client understands what is happening with regard to the illness or health health problem that is being perceived, and they find a coping behavior that is manageable. That is, my world or my problem is manageable. And third is, my world has meaning. So whatever coping behavior is suggested and whatever is the illness that is perceived by the patient, they can find some coping mechanism that is meaningful to adopt. So this was proposed initially by Antonovsky, who, after a study in Austria in the 60s, published a landmark paper in 1960s. And studies in 70 countries have shown that these seminal principles are in fact true. Several studies have confirmed. And he enunciated that comprehension, manageability, and meaningfulness is the basis of sense of coherence. And the manageability in particular requires general resistance resource and specific resistance resource to oppose the stress that is causing illness or ill health. So Antonovsky proposed that a strong sense of coherence approach helps an individual to cope better with the stressors and feel well despite life's challenges. My surmise is that music therapy is a general resistance resource and fosters holistic care. And evidence-based music therapy could be a specific resistance resource in some diseases especially those few 20, 30 conditions that have already been published in Cochrane Abstract as evidence-based specific resistance resources to improve patients' conditions. I'll give one example how, in spite of a terminal illness, music therapy can provide joyful moments. So this was a patient in Pondicherry, India, where Sumati Sundar and I worked together. A sad patient was aware of his impending demise, terminal cancer of the gut. And the music therapist, the young lady, finds out the best song he has enjoyed in his life. It was from a Tamil movie in the 1960s. So even though she doesn't know the song, she learnt it overnight. And the next day, along with the guitar player, they came and played the song. And the patient was slowly warmed up and became happy and sings along with a clicker in his hand and beating to the rhythm. And he thanks the therapist and wants it every day. Says, please come and give me this 10 minutes of joy and kind of sense of purpose. And he was hearing it daily for the next few days. And then one day they found the bed empty because he had succumbed to the terminal cancer. In fact, this incident is what made me get as president of the university, I could bring music therapy and yoga therapy into mainstream just with these two questions in a medical meeting, a staff meeting. I asked the medical doctors to introspect. With all the powerful remedies that we have in our armamentarium, can we, in oncology, make a terminally ill patient alive and smile when we take rounds? They all looked totally lost because it is impossible for us to do that. Then I asked, if we cannot do, why not invite music therapists who can do so to give a few hours of joy to the terminally ill before they pass away? Let us all introspect. Then from next day or next week, the therapists got entry into the various places like cardiac catheterization lab, the labor room where babies are being delivered. And whenever conscious surgery is done, the music therapist sits by the head end with anesthetist and keeps the patient engaged with music and other ways of engaging them. So you have to come and see it, how it got engaged, how music therapy has entered into mainstream medicine. OH is the optimal healing environment, the last one, the external domain. Building healing spaces, color, light, architecture, aroma, music and sound. So the music and sound aspect can be greatly influenced by a therapist and adding value to the external factors by creating a healing milieu through music and sound vibrations. Now quickly, part 3, the evidence-based music therapy practice is based on 3 things. The best external evidence, the scientific medicine, the individual clinical expertise, and clients' values and preferences when we suggest options. So together, these 3 overlap to create evidence-based music therapy practice. And there are 5A processes to practice evidence-based music therapy practice. That is, ask clinically relevant research question that pertains to your client. So that is individual clinical expertise. Acquire and appraise the research evidence. That is the 2 steps for to get the best external evidence available. And step 4 is apply the best evidence for the client after collaborative decision. That is, after mutual discussions, we decide on that. And finally, assess client response and proceed accordingly. That is client value and response, along with our individual clinical expertise of assessing the client's improvements. So this in brief is evidence-based music therapy practice, which combines scientific principles along with the expertise of the individual music therapists. And we can even go beyond this to holistic approach to patient care. That is patient-centered care, engaging them in care decisions and considering their perspectives. Collaborative care, working with other health professionals who address various other aspects of patients' illness and health. And cultural competence, understanding and respecting patients' cultural background and beliefs. So the take-home message is one can combine scientific and humanistic medicine in any field of healthcare and therapies. So the questions to ask about an individual patient who has a health problem is the individualized holistic approach, looking at the mind, body, and spirit. And the current evidence-based scientific knowledge about these problems is a scientific approach. And when we combine both and we can practice evidence-based holistic care that is patient-centered. And if the researchers and experienced therapists collaborate, we can bridge the gap between scientific knowledge and empirical practices to usher an era of evidence-based, patient-centered music therapy. That is the message I wanted to give you. Thank you all. Thank you all for this invitation to share my thoughts with you based on more than 50 years of practice as a physician. Thank you very much.